Welcome to the Anatomy of Inequity, a podcast that examines how systems, structures, and history shape health outcomes long before a patient enters the clinic. This podcast is designed for healthcare students and professionals who are willing to look beyond individual behavior and examine the conditions that produce unequal care, because outcomes aren't accidental and inequity has an anatomy.
All right, this is the second episode of Anatomy of Inequity, and I have the wonderful pleasure of sitting down to talk to somebody I have named Mama P.T. Soror. Sorry you don't know who that is, but you might find out a little bit later on. But Dr. Senobia Crawford is a gem to our profession, and I am just so excited to be able to speak with her. You can read more about her in the bio because I want to use the bulk of our time to have our discussion. So I sent a couple of questions to Dr. Crawford that I would love for her to answer, specifically around the topic of health disparities and children. All right. So here's the first question, Dr. Crawford. In your Campbell's chapter, you bridge the gap between clinical care and the social determinants of health. In your years of experience, how have you seen systematic inequities drive the current rates of prematurity and infant mortality?
Wow. Excellent question. When I read it, I was like, wow, that's pretty much been my both clinical and academic experience. So I'm just going to start with almost everything that a child experiences from their prenatal days, months, birth, and then through their arrival has to do with every part of social determinants of health. We think about, or I think about that prenatal environment. What was that mom going through? What support did she have? What did she have the basic needs that Maslow talks about? Did she have shelter? Did she have food? Did she have water? As we move up, I want to know, and which was big when I first started, did she have adequate health care? And by adequate, I mean during those prenatal years, prenatal months, you want that mom to be under the care of a physician. So if something comes up, you can address it immediately and therefore have a better outcome for that baby. My research was on children prenatally drug exposed. This is a population that, because we know drug use is a crime, so mothers who are using drugs, they're not going to show up for that prenatal visit. Because if they do and they take the lab work, then they know that they're using drugs. And in some places, that's crime. Who wants to be incarcerated? So the population of moms that use drugs during their prenatal term, they didn't have that care. They show up when it's time to have the baby. They show up when they've used drugs, it's in their system, and they go into premature labor. It is a very vulnerable time. And so therefore, this whole environment for that baby, from beginning to that birth, has been traumatized. We, as researchers, I would go in within the first, memories bother me now. Let's say the first 20 hours after that baby's born. So sometimes I'm in that nursery in the wee hours of the morning. Already we see the impact of drugs on that baby's system. I like to tell my students, whatever that mom takes in becomes magnified in that little tiny organism. It becomes magnetized. Mom may say, I had one drink, baby had 100. Moms may say, I took one shot, whatever, baby had 1,000. So that little tiny organism is trying to deal with this adult decision to use drugs. And so it sets them up. Uh, I don't want to say for failure because all don't fail, but it disproportionately impacts development across the lifespan. And the answers to those questions, how is it impacting, how much does it take to cause these fetal alcohol syndrome? How much of an opiate does it take for the baby to have some type of neurological defect or cardiac defect? We really don't know. We have good data out there now, but to actually be able to say, okay, you can take this much, we don't. We don't. Because sometimes a mom may say she was just binging, but then the baby has fetal alcohol syndrome. Some would say, I seldom had alcohol, but they have it. So that impact starts early. And then when you start considering the environment, okay, that built environment, it just begins to magnify that problem. I have worked with children or been a part of families where they've adopted a child, and that child seems fine, until they hit the school system and maybe they have attention problems or something of that sort. But I have seen good outcomes. But unfortunately, in my experience, I've seen far too many not so good outcomes. So when you talk about that built environment, you know, what is that community like? What is their housing situation? Is this a community where there's problems with food, the uh, food insecurity? Do they know when they're going to eat? As a physical therapist working in Selma, that's when I saw the greatest health disparity. I've worked in Washington, D.C., Maryland, Virginia, Los Angeles, in some of the toughest areas, Compton, um, Watts. But it was not until I moved to Selma and practiced there. I was on faculty at Alabama State. I was the former chair, full-time faculty member for a number of years. Very involved with the community. I was also the, um, I believe it's called director of the patrons for the National Center of Civil Rights that the university has. So I learned a lot. What an education. Uh, but what sticks out for me, even today, is that every year when I practiced in the school system in Selma, I lost a child. It was an experience that said, this is health disparity. Asked me about my whole career. And in 2 years, it'll be 50 years as a PT, pediatric PT. I've never lost children like that. It has really shaped who I am and what I do. I don't show up at HBCUs just because. I show up because I know we need more health professionals that look like me in our communities to save our families, to save not just the children, but the adults, our mothers, our fathers, our grandparents. We need to show up for them. Because we take a lot, Be nice to your HBCU faculty folks. Be nice. Because they are there by choice. And we need it. In Selma, again, I could call today and get a catch up, and they're going to tell me somebody died. Sometimes the child that I thought wasn't going to die, died. Because they did not have that watchful eye. When we as physical therapists are in those settings, when we as nursing, other health professionals, we are looking to see those signs that says this kid may be in trouble. One of the kids I lost, he had gone through the whole school system. I met him in elementary school. He graduated high school. Less than a year later, he died from a complication. your built environment that doesn't have all the resources. No, I would tell students at Alabama State, I would debrief them. When we go out there, leave your biases here because this may not look like where you grew up, but it's where they're growing up. And we got to meet people where they are and help them get where they need to be. And I want to tell you, it's a highlight of my career because Alabama State students showed up. My first year, I said, you know what? This is just too far. 57 miles one way. They have to provide their own transportation. They were group sharing and stuff. And I said, we're not going to do this. They said, well, we like that. I said, no. They came to my office, students came to my office with a proposal and said, we're ready to go to the dean and demand that we continue. What? I said, no, please don't do that. They go, why? I said, because it's not her. She did not say that. I was saying it because I don't pay you. I don't reimburse you for gas or anything. And I want it to be clear. I didn't reimburse myself. I paid my own gas. The days I took the students were outside of the days I was contracted to practice. I made it a win-win for everyone. It helped the students. It helped me as their professor. But most importantly, it helped the students, the teachers, and the whole administration in Selma. So those children didn't just get that IEP therapy that I provided. They received therapy from those students. The teachers received ideas from those student evaluations of what to do for those students. I want to share this because I know I don't have much time. What touched my heart was, I believe it was the second class I took there. They were so moved by the students. I had nothing to do with this. The students, got together and bought Christmas presents for all the children that they interacted with. These weren't just any Christmas presents. They were presents that were specifically selected for that child. So you say, what do? That's what we do. We show up, we show out, and we leave a legacy of help. So the child who would show up without a coat, they bought a coat. The two boys wanted, what is that thing called? Big wheels. It was only in school. They bought both of them bikes. There was another child who I didn't even want them to work with because she was so involved. They got her to roll and then bought her a soft blanket or something. My point is that they took their knowledge, their skills, their abilities, their talent, and went well beyond what I presented. On this one, I'm going to conclude with this. One of the students is from that community. He now is big in Birmingham. But I'm so proud of him because he has gone back to Selma and started a community organization for students there. He has also traveled globally and started programs to assist. That's what we need. That's what we need because things that impact children in utero will continue until somebody shows up and has a positive intervention. So I always say, as we reach forward in our careers, make sure you reach back and bring somebody with you and continue to support them. So, Dr. White, I love you, and that's what you're doing. So that was my answer to that question.
You should see me. I'm over here rocking, trying to be silent because I am so engaged in what you're saying. You answer so many questions. I really don't even think we need to go further in the questions because it was so full what you said. And I'll say this, and then maybe we can have a wrap up, and then we can be done because I'm telling you, you have just filled me with just that moment, snippet of sharing your experience, your lived experience with us. I love what you said because some of my students this week were just asking, okay, we understand that health disparities exist, but what do we do about it? And you just answered that question. And I think it starts with understanding our values, understanding our ethics, and sticking to them. So
That's
I'm
right.
going to kind of end this segment with talking about how did you get here? Like what early on, I was supposed to ask you this question. What early on do you think in your life started you down this path of consistently fighting for the least of these?
Mm. I think throughout my life, because my father was military, he's in the Air Force, I've always been around advocacy and people fighting for something. I remember being in third grade and being on Air Force Base in Missouri with signs, and this was a very diverse group because it's Air Force, and we have signs walking up and down the street, uh, protesting. And, I think it was when Kennedy was killed, and we were so saddened by that. And we out there again protesting on our little block. Growing up in Washington, D.C., where everything had to do with politics and the government. My first job, Department of Justice, law enforcement, assistance administration, being exposed to so many things and being exposed to just visiting prisons, jails, as part of a summer program. It had an impact on my life to see so many folks incarcerated and feeling as though they just got the wrong end of the stick, and maybe had their life situation been different, things would have been different, and wanting them to be different. Um, and I've always worked um, in, I'm going to say, Black and Brown communities, and understood the challenges that come with that. I always appreciated those people showed up in my life. Educators are wonderful. I still remember my English teacher, Miss Muse, seventh grade, very political. Talk to us. Why do you spend your money at the store that makes you line up outside? I wouldn't give them a damn dime. That's how she said it. And we were like, huh? We stopped, right? I love throughout my career folks who have challenged me to think differently. And I tell my own children, I never set out to be a millionaire. I set out to make a difference. In my office here, I have a sign, it won't matter what happened 100 years from now. It won't matter what I wore. It won't matter the car I drove. It won't matter the house I live in. But what will matter is the difference I made in the life of a child. I read that, and everywhere I go, I have that. I look at it every day because it ain't about me, you know. Um, the children I have served, the families, have been more education than often what I read in a book. They made me stop, reflect, think about myself, and check my own biases at the door so that I can fully come in, engage, and see what I need to see, you know. And I engage everyone. I'm known to be known in the school system by all the kids. The coordinators say, are you working with that child? No. How do they know you? Because when I come in, I talk to everybody. I use my talents to help. And if so a kid struggling with math, well, and doing my PhD at UCLA, I studied cognitive development. So I would sit down before I see the kids I'm supposed to see and help her. At the end of the school year, her mom gave me a gift. I thought it was a mistake. I don't work with her. That must be for Tasha. They said, no, it's for you. So obviously she told her mom, but I love this little girl. I saw her challenge and I did it. I just want to show up, always show up, because And I can say this honestly, I have been blessed a million times over, not by what I've received, but by what I've given. And I want our therapists, our young therapists coming out now, yes, you're a doctor, but be more than that. Be someone who cares. Be someone who has compassion. Be someone who wants to make a difference. Because if you don't, what does it mean to be doctor?
You have said it all. I don't have anything else to I'm so full every time I speak to you. You just do not know. You are doing exactly what you set out to do. Thank you so much for spending
Well,
some time
thank
with me.
you.
I
Thank
know I did
you.
this for my students, but I really did it for me selfishly so I could talk to you one more time. Thank you so much for sharing your wealth of knowledge with us. And I just appreciate you and continue to keep the good fight of faith.
And I want to just say hello to all the students at Alabama State because I used to be there. So you're in a good place. I got lots and lots and lots of friends at Alabama State. So congratulations to you and don't give up. Keep going. And as I told students when I was there, that DPT is only the beginning. Get that post-professional doctorate, specialist, credential, or something, and continue to make a difference. Thank you. Thank you so much.
As you move forward in this course, remember this. Health disparities are not simply about patients, they're about systems. And as future clinicians, you don't just treat bodies. You practice within structures that either reinforce inequity or interrupt it. Reflect on how this episode connects to student learning outcomes and how that understanding may influence your clinical perspective. This is the Anatomy of Inequity.